Hello everyone, my name is Safa and I'm a family nurse practitioner student. Mr. Patel is a 38 years old American Indian male patient with medical history of diabetes mellitus type 2 for 5 years of evolution, treated with metformin 500 milligrams twice a day. Also, hypertension of 1 year of evolution treated with hydrochlorothiazide 15 milligrams once a day, and also anxiety disorder treated with citalopram for more than 13 years of evolution. This patient came to the clinic today for a routine checkup after he has done some blood work last week. It's important to say the patient hasn't checked his blood sugar and he's not monitoring any blood pressure at home. Patient leads a sedentary lifestyle and with an unhealthy diet, and reports that food sometimes becomes his ally to combat the stress. So the patient in the last few months has gained 15 pounds, being more noticeable and the lower abdomen. The patient reports polydipsia and polyphagia of 1 month of evolution. No allergies reported, and the patient has a family history of hyperlipidemia, diabetes mellitus, and hypertension. In the social history, we can say the patient denies the consumption of alcohol or tobacco or drugs. During the encounter, patient was calm, cooperative, able to follow commands, no aggressive or irritable behavior noticed, oriented in all spheres, with the vital signs weighed to 33 pounds, height 5'9", normal temperature. High blood pressure was a little high, 146/94. Heart rate 75, oxygen level 98%. A1C was checked 6 months ago and was 7.5. Last week report 9.3%. Also, the blood glucose was checked 6 months ago and was 142. Now is 210. For the assessment, we can say the patient has uncontrolled diabetes mellitus and type 2 and uncontrolled hypertension. Patient can be also developing obesity, and we can also say because the stress situation, anxiety disorder exacerbation. For treatment plan, my first recommendation would be to discontinue the current regimen for diabetes and hypertension based on metformin and hydrochlorothiazide, and then initiate a new treatment with glipizide and metformin combination 2.5 and under 500 milligrams twice a day with meals. Also, for hypertension, I would recommend lisinopril with hydrochlorothiazide 10/12.5 milligrams once a day. It's also important for the patient to check his blood sugar and also his blood pressure at home. So I would order a glucometer and a blood pressure machine in order that the patient can just pick it up from pharmacy and check his glucose and blood pressure at home. I also would recommend the patient some therapies in order to manage his anxiety as a non-pharmacologic treatment. It is also important to educate the patient about the benefits of a healthy diet based on complex carbs and protein to reduce the weight and also reduce the risk of complications such as metabolic syndrome. The patient should be periodically monitored to evaluate the efficacy of the new treatment plan, and laboratory tests should be performed every 3 months to monitor the metabolic panel lipid panel, kidney function, and electrolytes levels, and also the A1C.